The broadcast is now starting. All attendees are in listen-only mode.
Hello and welcome to our webinar, Healthcare Reform, the Key Changes and How You Need to Prepare. My name is Julie Dorr and I will be your moderator for today's event. Our presentation will last approximately 40 minutes with the remaining time available for your questions. Earlier this morning, too, we sent out a link for the presentation as well as a PDF that we're going to be covering in our webinar today. If you haven't received it, feel free to email me right now. My email is on the screen. It's julie@enlightenbiz.com, and I'll send you those documents right away. Before we get started, also note that the webinar and all of the accompanying materials are protected by copyright and that the entire conference is being recorded. This presentation provides general information only and does not constitute legal advice. We recommend that you consult with legal counsel to address your specific situation. Also note on the left-hand side, or I'm sorry, on the right-hand side for some of you, there is an area where you can submit questions. There's a question and a chat feature. Feel free to just expand by clicking that plus sign next to the questions and type in your question at any time. We're going to reserve questions for the end of the presentation so that you can actually get them in the queue and we'll be able to ask them as soon as we conclude the presentation. So let's get started by welcoming today's expert panel. Let's start with attorney Marla Merab Robinson. Marla is with the law firm Merab Robinson & Jackson, where she is a partner and head of the firm's transactional department. She primarily practices in the areas of corporate, mergers and acquisitions, real estate, finance, and employment law. We also have Linda Duffy, president of Ethos Human Capital Solutions. Linda works with business owners and executives to provide strategic human resource direction, develop leadership talent, and increase organizational effectiveness. You know, Linda, I'm going to turn it over to you real quickly so you can tell attendees a little bit more about the HRCI credits and also introduce our third panelist.
Thanks so much, Julie. Welcome, everybody. Marla and I are really pleased with today's webinar, not just because it's going to be a great webinar, but because we have it easy. We are going to be participants just like everybody else. We have definitely brought in the expert today. We have gotten this program pre-approved for one general recertification credit hour. So for those HR professionals that are on the webinar today that need credit toward their recertification for their PHR, SPHR, or GPHR, just make a note on this slide of the program number so you can make sure that you get credit for that. And if you need a certification of that later on, we'll be happy to send you a certificate, but just make a note of that program change. And with that, I'm going to go ahead and introduce our expert speaker today. I've known Lawrence Hartley for a few years, as has Marla, and you guys are in good hands today. I can't think of anybody more qualified to do this presentation. Lawrence is the president of Oak Ridge Advisors. He's been in this business for a number of years. Marla and I both get phone calls all the time asking, you know, what do I need to do about healthcare reform? What's going on? What are the changes? What do I need to do to be in compliance? And honestly, both of us have the same approach, which is to say, call your insurance broker or call Lawrence if you don't have one or need a second opinion. So we're really excited that Lawrence is here today. You can see a little bit about his bio on the screen, but just know that Lawrence is the one that I go to with all of my insurance questions and recommend him to all of my clients. What I like about Lawrence is he's a very creative problem solver and very much a strategic thinker. So he's always looking at the big picture when he goes into a client, almost to the point of doing like a little SWOT analysis. He doesn't just sell insurance like a lot of brokers do. He really takes an overall strategic approach to helping the client do anything better in their business, streamline processes. He takes a look at all the different areas and makes some recommendations on how they can be a more effective company. So with that, Lawrence, welcome so much. Thank you so much for being with us today. Welcome, and I'm going to turn this over to you because I know we have a lot of content we want to cover today. And at the end of this presentation, Lawrence will take questions. So as Julie mentioned before, feel free to just shoot those over in the chat area or save them to the end, whatever you prefer, and then we'll have a little bit of time that Lawrence can answer your questions.
Well, thank you very much, Linda and Marla. We really appreciate you having us on for the webinar. And I know when I first sent over the presentation over to Linda, Linda goes, Lawrence, this is 53 slides. You need to narrow it down. And I said, Linda, I dropped 14 slides already. So we're going to try to make this as quick as possible in the areas where we think they're kind of no-brainers. And in the areas where we need to spend a little bit more time, we'll slow down, we'll pause, we'll go through a few more items on it, and then we'll speed through. At the end, you will have an opportunity to ask some questions, and then obviously offline after today if something is unique to your situation. So with that, I will go ahead and get started. We certainly have an agenda for you. We'll give you a little bit of background. We'll talk about who needs to comply and which plans. We'll talk about what's currently in place, what's about to be in place, and what is the future, and what will happen in the future. And at the end, what we'll do is we'll talk about how it impacts two sets of groups, and really the groups that are between 2 and 49 employees, and then the groups that are 50 or more. We'll define that, and then we'll also tell you what you need to know as we move towards the implementation of most of the mandates for healthcare reform. Okay? And then finally, we'll end with questions. So just a little bit of background here in terms of legal status. It was June 28th that finally the Supreme Court ruled that, yes, it's going to be upheld, meaning the individual mandate. And the individual mandate stated that everyone must have insurance by January 1st of 2014. And because that was held to be constitutional, the rest of the law was upheld too. Many folks held out thinking that there were going to be changes. And then they said, well, gosh, maybe the elections will take care of it. And that didn't happen. So really what's next for it is that it's definitely moving forward, full steam ahead. The question is, there are some areas where interpretation, where they will fight over how the law will be interpreted and the regulations moving forward that will make sure that people have to follow. That's still in flux, but for the most part, the law is moving forward, and January 14th is the bulk of the laws when they take place then. A lot of people think that healthcare reform is very complicated. If I were to put it in a nutshell, it would be 3 simple bullet points. Number 1, everyone, regardless of the size, must adhere to notification and compliance. And we'll talk about those pieces. The second item is only for groups over 50. For groups over 50, you have to offer affordable coverage and coverage that meets essential benefits, or you face a penalty. And then from the individual perspective, you have to have insurance or pay a penalty. That penalty starts off small and increases over time. But at the end of the day, you take those thousands of pages, it's really all it's about are these 3 bullets. So first question is, which plans must comply? The bottom line is pretty much your group health plan. Okay? The dental, the vision, the disability and life, for the most part, is not subject to healthcare reform. It's primarily your health insurance plan. Okay? Let's talk about some plans that are already in effect and some parts of the law that are already in effect. So groups under 25 are eligible for a tax credit. If you want more information about that, something that your CPA would help you with. Dependent coverage up to age 26, and that's regardless of their education status, as long as they're not working, as long as they're not being offered benefits through their employer, they can be on your plan until the age of 26, or in other words, through the age of 25. No lifetime limits. That's a change. It used to be limits as to total benefits. No rescissions, meaning they can't rescind or cancel coverage with a retroactive effective date, except in a few instances such as fraud. No pre-existing condition exclusion for children. So if you have a child now, even right now, and they have a disease and they need to get care right away, there are no pre-existing conditions. And for adults moving forward on January 1st, that will happen. No cost sharing for preventive care means zero cost copay, zero copays for preventive care. And that's age appropriate. So that can mean office visits. It could also mean labs. It can mean well woman exams. It can mean colonoscopy at age 50, the fun stuff, right? And appeals process, there must be an appeals process. Reimbursement on flexible spending account goes away for over-the-counter drugs unless you have a prescription. And then medical loss ratio, this is holding the carriers to where they must spend either 80 or 85% of every dollar they take in towards claims. So those are provisions that are already in place. And so what we want to talk about now are some compliance deadlines. And the first one is W-2 reporting. has everyone added in the total cost that they paid towards an employee's medical plan during the year of 2012 and had to be reported in 2013 in January? If not, don't worry. It's only for employers that filed at least 250 or more W-2s. Now, the question I get here is sometimes you might only have 50 employees, but if you have a lot of seasonal employees or if you have a lot of folks that are part-time, you can easily get over that 250 number, and you would be subject to that. If you have any questions about that, definitely contact your payroll company or your CPA as it relates to that. Okay. Summary of benefits and coverage. This is a big deal as it relates to compliance. It's easy to comply, but it's something that you must do. This went into effect originally last year, and really when you have to do it is at your first renewal after September 23rd of 2012. Okay, so if you haven't had your renewal yet, then it's something that you have to do moving forward. And really all it is that you must provide a simple document that explains the benefits and has two examples. One example is a person who has diabetes. Another example is the birth of a child and the expected cost. Those are uniform examples that go across all plans, so that way you can compare them fairly. But the summaries of benefits and coverage is not something that you have to create. It's something that the carriers provide. The only thing that you have to do is that you must provide it to the employees. And what we have found, and the best practice is, nothing beats a signature. Okay, nothing beats a signature. Best time to do it is at least at open enrollment, and hopefully you have that 30 days in advance of the renewal. If you plan on changing the carrier, as we oftentimes do, to save on rates or maybe to improve benefits, you must provide them with the SBC at the time of enrollment. Okay. So SBC, summaries of benefits and coverages, a critical compliance piece as we move forward, and something that you should be doing right now. Now, if you missed it, let's say your renewal was January 1st and you said, wow, I didn't know about this, what's going to happen now? The first year, they are not going to enforce this. That being said, we are getting our clients in the habit of doing it, even though the enforcement isn't there, because we want them to create good habits of compliance moving forward. So that's it as it relates to the summaries of benefits and coverages. The next item is the 60-day notice rule, which simply states that you cannot make a material modification, whether it be an enhancement or a plan reduction. And that means something big. So you can't make a big change to the plan without providing at least 60 days notice. The one exception is at renewal. If you are changing at renewal, then you don't have to worry about that 60 days. You simply have to provide the notice at renewal. Okay. Preventive care for women. This is a law that went into effect on August 1st of 2012. And this notice must be given out to employees. And the effective date for you as the employer is your first renewal after the law went into effect. So if your plan renewed in October, then you should have included this information in there. If it renews, let's say, in March or April or May, then you still have time to provide that information to them. But the preventive care for women essentially allowed for low or no cost benefits for women. But the biggest one that probably most folks will see and hear about is that contraceptive and contraceptive counseling is provided at low or no cost. Increased Medicare tax. This is more for you to be aware of, but this is also something that your payroll company should be helping you with. But the bottom line is that high earners will have a higher Medicare tax rate. With regards to flexible spending account, we know a couple of years back they removed the ability to use your flexible spending account at the groceries, at the pharmacy, towards non-prescription or over-the-counter drugs. Now, in order to have that go through your flexible spending account, you simply need a prescription for that. But it tends to not make sense to go to a doctor, pay $20 for a copay just to save a few dollars on over-the-counter drugs. But what we do recommend is when you have your annual checkup, and let's say you do have allergies, to get a prescription for those over-the-counter allergies, and then you can run it through the flexible spending account. Beginning in 2013, this year, January 1st, and for plans that have a start in 2013, the maximum is $2,500. That may increase in future years if the CPI increases, but as of right now, $2,500. Comparative effective research, right now about 2.5% of your renewal increase is due to mandates that are currently in place. And one of those is the comparative effective research fees. Essentially what it is, it's $1 per covered life, and it increases to $2 in the next year, and then moving forward, it increases based on the CPI there. But these are dollars that are spent to have a center that determines and provides information on how things can be done better. Okay, so how can we improve it? Notice of the exchange. This is something that had to be done as of March 1st, 2013. But wait, the insurance exchange wasn't ready. So what they did is they came out with notice recently saying, all right, we missed that original deadline. Don't worry, we should have it set up by the end of the summer. So when that happens, you should receive notice either from the carrier, from the broker. Someone will provide you with model notices that you can provide to your employees. It's critical that they get this because they must be notified that they do have rights and that they do have the ability to go to the exchange. And for those of you who are not familiar with the exchange, really what it is it's just a marketplace where employees can buy individual health plans, and it's the only place that if they are under 400% of the federal poverty level where they can receive a subsidy, a federal subsidy. Okay, we'll talk more about it towards the end, but right now what we'll do is we'll leave it at that and the exchange. So notice of the exchange coming up, summertime, end of summer, look for it then. Very important that this goes out. Okay, 2014. So now we're pretty much caught up. We talked about what is in place, what you needed to do in 2012, the compliance issues in 2013. Now let's talk about 2014, where the bulk of the mandates go in and they become effective. Okay? The first one is the individual mandate. Beginning January 1st, 2014, all individuals must enroll in coverage or pay a penalty. Now, the penalty, in my opinion, is laughable because it's only $95 or 1% of what they make. Okay? So $95 minimum or 1% of what they make. So let's say you make $20,000 a year, you decide not to pick a plan through your employer, or maybe your employer doesn't offer it, and you don't want to go to the exchange and pay any dollar amount, you can do that. But if you do that at a $30,000 rate of pay, you'd essentially pay a $300 penalty. It's the greater of 95 or 1%. In the future, it goes up, 325 or 2%, 695 or 2.5. We know that right now in Massachusetts, which is where they're mimicking a lot of things that Massachusetts is doing. Right now, the penalty is about $2,000. And we think that until they get to that number, it's difficult, and we'll still see a lot of people that will just decide to pay the penalty as an individual instead of going on to either the group plan, or if the group plan is not available, going to the exchange. Health insurance exchanges. So in the state of California, there'll be two public exchanges. The first one, and where we think that most folks and where the most activity will be, is on the individual exchange. It's going to be called Covered California. And under Covered California, employees will go to the website, determine their eligibility, and based off their eligibility, mostly based off family income, the program will determine how much of a subsidy that they will receive. Okay? There'll be 4 different types of plans. We call them the metallic plans, and they'll start from platinum, go down to gold, silver, and then bronze. And they'll be able to pick those different coverage levels with different carriers. Okay? As to how competitive they are, we'll find out more, but what we do know is there's a cap as to how much someone will pay, and we'll discuss that on a grid moving forward here. For the small groups, and by small group we mean the 2 to 99, they have what's called SHOP, and it's an acronym for Small Business Health Insurance Option. And the SHOP is, we believe, mostly going to be suited for companies between 2 and 10 employees. And the one interesting thing is that the rate inside of the exchange will be the same outside of the exchange. And what's nice is that you can only purchase this through a broker. So your broker will show you both sides. So it's not as if your broker will only show you what they can offer. They will be able to offer both. And that was very important. They brought us into that. Right now, it's only groups under 100 that are allowed to go to the exchanges, but in 2017, it'll be groups of any size. And under the health insurance exchange, that's where they'll get the subsidy or tax credit. I know that this is blurry, but this is as good as I was able to get it. But I'm going to walk you through. This is on the Covered California website. Okay? And I'm going to walk you through just to give you an idea of what the costs will look like and what the plans will look like. So the first thing that what really determines how much of a subsidy you'll receive is your family income level. So in this example, we're using a family of 4. And on this family of 4, here are the income levels. The first one is $23,000 up to $35,000. How much that employee will pay for themselves individually, okay, is $39 all the way to $118. So basically, they've locked in what their contribution is. They haven't locked in what the total premium is, just what the contribution is. And that's for the silver plan. So the silver plan is, this is platinum, gold is the second, and silver here. So $39 for an individual that makes about $23,000 is a pretty good deal. What do you get for that? Well, it's going to be about a $1,500 HMO or PPO plan, $45 office visits, $55 for specialty care, urgent care will be at $90, emergency room copay will be at $250, and then on the hospitalization, you're looking at somewhere around 20% there. Okay. Prescription drugs will be available, and the brand name will have a $500 deductible, separate deductible for brand name drugs. Okay. The maximum out of pocket, the safety net, will be about $5,200. Bottom line is, it's not the best of plans, but it's a decent plan, and it's going to be very affordable moving forward there. So this will give you a little bit of an idea of what the costs are moving forward. Okay. Employer responsibility. Now I'm going to have you think about, this is more for your large employers. So this is your 50 or more, okay, 50 or more. Large employers will be subject to pay or play, and essentially it means you either establish a plan that's reasonable in price and a decent plan, or, and if you do that, you won't have to pay the penalty, or you can choose not to do that and simply pay a penalty. Okay? So this only applies to groups that have 50 or more. If you're under 50, you do not have to worry about that. Very important. If you're on the border, right, to where you fluctuate up over 50 and then sometimes below, it's important that you actually do an analysis. I recommend contacting your broker to help you with what we call a pay or play calculator, and also for the full-time equivalency calculation as well. Okay? So the penalties, again, will apply if, and where they're triggered, is if an employer does not provide health coverage to all full-time employees, and any one full-time employee gets subsidy on the exchange, that's what will trigger the penalty. Okay? Or if the employer does provide coverage and an employee still gets subsidized coverage through the exchange, meaning that you provided coverage but it wasn't affordable, or it didn't meet minimum essential values, then you'll also be penalized there as well. Okay? If an employee cannot afford your plan or it's not reasonable, they are able to go onto the exchange and they will receive subsidies as long as they're not eligible for other government plans like Medicaid, as long as they meet the income requirements, essentially less than 400% of the federal poverty level. And if the employer, as I mentioned, doesn't offers a plan that is unaffordable and does not meet minimum value. Okay? So These two items, the affordability and the minimum value, is what an employer needs to know who's over 50 to protect themselves. It's what we call a safe harbor, okay? And I'm going to skip to safe harbor real quick, and then I'll go back to the penalty. As with 401ks, if you adhere to certain rules, then it doesn't matter what the employee does as long as you comply with the rules. And the two rules that you need to be concerned with is, A, is it affordable? And the way that affordability is determined is 9.5% of the family wage, or 9.5% of the W-2 wage that they made, or how much they make as a rate of pay. And then you can also use the federal poverty line. This one's the most, this would be the easiest for folks to qualify for. Most of the folks that we understand, most of our clients, think they're going to use rate of pay. So if someone makes 15 bucks an hour, they average $32,000 a year, you need to make sure that they're not paying more than 9.5% of $32,000 per year. Now, when they go onto the exchange, this was all based off individuals. When they go onto the exchange, it'll be based off of the family income. But as it relates to safe harbor and employers, we only need to look at the employee. We only need to look at the employee. So number one was it affordable? The second thing that you have to do is you have to provide a plan that's what we call, that meets minimum essential value. And it means that, for the most part, it covers 60% of what happens in a year for the employee, 60%. And it'll vary. The carriers have come up with something that's different than what the exchange feels is reasonable, so more information will come out as to what they consider that 60% and what that will look like. Right now, it looks like about a $2,000 to $2,500 deductible type plan. Okay, I'm going to go back to employer penalties, right? So let's say you're over 50, you're an employer, and you say, you know what, I do not want to offer any health insurance at all. I'm just going to pay the penalty. Here's how it works. I have 50 employees. My penalty is $2,000 per full-time employee per year, okay? So the total amount that I'd be responsible is $2,000 times 50. But then what they do is they have essentially a deductible, so to speak. The first 30 employees don't count. So again, I have 50. The first 30 do not count. I have 20 left, full-time employees. I'm going to pay a penalty of 20 employees times 2,000. All right? A different example would be, what if I had 100? The first 30 are subtracted. It's 70 times 2, or $140,000 per year. What's important to know is this penalty is not tax deductible. So that $2,000 will probably feel more like $2,800, and then you have to pay Uncle Sam taxes, and then you'll net out $2,000 to pay Uncle Sam again the penalty. All right. And one of the things I'll say right now is there are less expensive options that provide coverage for your employees than paying the penalty. Never pay the penalty. There are far less expensive options that provide your employees benefits, and we think it's a better way to go. Let's say you're the employer that does what we call a carve-out, where you only offer coverage to managers, right? And then what happens is that for any person that goes to the exchange and receives a subsidy, it's not a $2,000 penalty, it's a $3,000 penalty, okay? So again, the first one is if you offer no coverage, $2,000 for each employee. If you offer coverage, it's $3,000 not for every employee, but for each employee that receives a subsidy, okay? And then, of course, they cap you to say, hey, it's not going to be any worse than if you didn't offer insurance. So you won't get hit harder in total, but you'll get hit harder per person at $3,000, right? Any more questions on that? We'll leave it for the Q&A session there. We talked about safe harbors. I do want to add in that waiting periods, as listed right now, federally cannot be more than 90 days, and that's not first of the month following 90 days. That's actually 90 days. So we are lobbying now to make it first of the month. And then in California, we have a special rule because we're special in California, right? 60 days, 60 days. What we think will happen is it'll end up being first of the month following 60 days, but more information to come, okay? More information to come. Penalty, if someone's in the waiting period, you will not be penalized for them. And we can rely on this information through 2014 and may change moving forward. Okay? Employer responsibility for groups over 50, they will have to report information. I'll leave it at that. There's more details, but generally speaking, you will have to report information, and it will be in your first returns in 2015, so about 2 years from now. Okay. All right, more 2014 changes that we'll just go through a rapid fire. No pre-existing conditions for anyone. Okay. Wellness program changes. You might have heard on CVS where they're actually charging folks based off of their action on the wellness program. It is allowable, and you can charge someone up to 30% of the total premium based off of the wellness participation, and actually based off the results as well. So few options there, and we have many clients that actually utilize this to encourage improving claims moving forward. The limits on out-of-pockets, maximums, and cost sharing, they've implemented that where you can no longer have these huge high deductibles, huge maximum out-of-pockets. Waiting periods have been reduced. We saw waiting periods of a year or 6 months. Now it can be no longer than 90 days or 60 days in California. Coverage for clinical trial participation. You can't terminate anyone, and you do have to continue coverage for folks who are looking to go for a clinical trial. Guaranteed issue and renewal, so no questions asked. As long as you meet the guidelines of a group, you can qualify. Or if you're an individual, there are no medical questions. It's all guaranteed issue. No annual limits on essential health benefits, and insurance premium rating restrictions. Okay. Future compliance, real quick here, 2018 Cadillac tax, there'll be a 40% excise tax if you have what's deemed to be a high-cost, rich benefit. This is why they'll be collecting data to put on your W-2 forms, we believe, because this is how they'll track that. But that's a few years away, and we'll see what happens, as now it's only 2013. Non-discrimination rules. This is something your broker probably shared with you in 2010 at the end, because they said that you cannot pay any more for the highly compensated. It must be equal across the board. You can favor the lower compensated, but you can't favor the highly compensated. And they actually they announced on December 23rd of 2010, hey, by the way, we're not going to enforce this. No changes for right now. We don't know when it's going to be effective, but we're preparing clients ahead of time to say, start it now, so that way it won't be a big change. So you must pay the same that you do for a janitor than you do the CEO of the company. Okay. Automatic enrollment rules, groups over 200 will need to automatically enroll their employees. All right, now let's get to the fun stuff here. Application. How do we actually use this information? What can we do to avoid or minimize penalties moving forward? And what can we do to keep costs down? All right? And what can we expect? So the first one, what I want to talk about is the impact on premiums for groups of 2 to 50. All right? So for groups of 2 to 50, 2 to 50 employees, few things that aren't being talked about enough. And we think that these are, we think it's going to be huge as to what the impact is. First thing is this. Right now in the state of California, you can have a ratio of, I believe, 6 to 1 or 5 to 1 as to how much you charge a 20-year-old and a 60-year-old. All right. So in the state of California, groups between 2 and 50, we have age bands, and the age bands generally go every 10 years, so 20 to 29, 30 to 39, et cetera. And right now, the ratio between a 20-year-old and a 60-year-old is 5 or 6 to 1. So that means that you could charge, for example, a 60-year-old $833. You could charge someone that's in their 20s $167, and that's a 5 to 1 ratio. Moving forward, they're getting rid of that, and it can only be a 3 to 1 ratio. The bottom line is that if you have a company with a lot of 20 and 30-year-olds, you're going to get substantially higher premium. And if you have a company with predominantly 50-plus-year-olds, okay, or maybe 40-plus, and that's the bulk of your employees, you might actually receive a reduction due to the lower age brackets, okay? So that's one moving part. The second moving part is that risk adjustment factors. For groups of 2 to 50, the standard rate is 1, and you can get a rating plus or minus 10%. That goes away. So what that means to you is that if you have a risk adjustment factor currently under 1.0, they're going to bring you to a 1.0, so you're going to expect it to have higher than expected increases. And if you're a group over a 1.0, you can expect lower. So if you are a group that is a young group, technology company, 20 to 29, are most of your employees, you have a good risk adjustment factor because you don't have many claims. We've been told that we're looking at numbers around 50 to 60% in increases. Okay? Conversely, if you're a group that is older or as I should say, more mature, and you have a high risk adjustment factor because maybe the claims are higher, while I wouldn't expect a decrease, I would expect that you would have a much lower increase than the younger groups there. All right. Also coming up in 2014, the cost of the mandates currently priced out. It's somewhere between 4 and 5%. And then, of course, you have regular trend, which is the increase that we typically see each year. So we have a lot of things moving. We have the typical increase. We have the 4 to 5% cost of the mandate. If you had a low risk adjustment factor, you're going to get hit there. And if you had a young group, you're going to get hit there. So a lot of moving parts. And I encourage you to talk to your broker and ask them what they anticipate your renewal to be so you can do some planning now. The last thing you want is next year to have someone come in and say, you were spending X and now you're spending X plus 50%. So planning is very important there. What else should you know? As we talked about, employees will be able to go to the individual exchange. What we really see are groups maybe between, really the 2 to 25 will see more of their employees where they might actually drop the plan and just say, hey guys, here's X dollars. You go out and go to the exchange or do whatever you need to do on there. Small groups, we really only see small groups between 2 to 10. And of the groups that are between 2 and 10 employees, it was estimated that only about 15 to 25% of them would actually go to the small group exchange. So we see this as a much smaller part. The covered California for the individuals would be much bigger. Calculating pay or play, if you are over 50, it's very important that you work with your broker to calculate the pay or play. We have calculators that are very expensive. And what's also very important is that if you are going to be subject to the penalty, that you start your planning now and no later than July 1st of this year. Because if you start much later, the measurement period that they're going to determine who's eligible for the benefits and essentially who they'll penalize you for will have already started. And if you wait too late, you won't be able to modify it. You won't be able to reduce or minimize the penalty. So highly encourage you to start your planning now if you're a group over 50 and you're subject to the penalty. And my last point here is, if you are over 50, my statement is, friends don't let their friends pay the penalty. There are so many other options that are less expensive than paying the penalty and will deliver a benefit to your employee, a true win-win situation. So the last thing I would ever tell someone is simply just to pay the penalty because there are far better options there. With that being said, I am opening it up to questions.
Well, Lawrence, thank you so much. Healthcare has been a hot debate going on in the media, and we really, really appreciate you taking the time today to help us understand the new healthcare laws that we're going to face in 2014. Now, for all of you attending today, that does conclude the presentation portion of our webinar. And now we're going to open it up to questions, and I see a lot of you have been sending in your questions. We certainly appreciate that. Let me just go through in detail how we're going to be handling questions right now. There is a section over, and it's typically on your right-hand side. It says questions. It's got a little plus sign next to it. Just click that plus sign, and then a panel will open. And at the bottom is an open white box. You just type your question in there and hit submit, and I will read those aloud for Lawrence, Linda, and Marla to answer. Also, we are allowing for email questions as well. If you'd like, you can send an email to me directly to hopefully include that into this Q&A. It's Julie, Julie, at enlightenbiz, enlightenbiz.com. So let's get started, Lawrence. We do have quite a few questions, so let's pull this out here and get going on the questions. The first one here from Tanya, and I've noticed it too, and it's just ironically today we have the webinar going on. headlines going out where employers are saying, hey, this isn't going to cost as much as we thought it was going to cost. And Tanya is saying, you know what, they're hiring. You know, a lot of employers and maybe people online today are going to be hiring people. And, you know, how do we expect, how can we project what we're going to be paying for next year when we don't know what we're going to be having for employees? So I guess the question here, Lawrence, is, you know, we're in a state of flux right now, so I know people are real concerned about cost. Is there a way for some of our listeners today to be able to more accurately project what they will be paying in 2014?
Yeah, it's a great question, and you know, the first question that I have for Tanya, and by the way, great name, that's my wife's name. Hopefully that's not my wife setting up a nice question for me. But it would first start off with, what size group are you? If you're under 50, if you want to control cost, you're not required to offer insurance. And one of the strategies that most folks use under 50, if they want to control the cost, is they fix the dollar amount of the contribution that they pay out. So, for example, as long as you're meeting the carrier minimums, which generally are $100 per person, and as long as you still meet participation requirements, then you can fix the dollar amount that you pay. And we like that for growing companies. A lot of our startup companies use a fixed dollar amount because it's scalable. They can say, hey, I'm going to set it at $350, and that's what we're going to pay for medical, dental, and vision. And at $350, I know if I hire 10 people, that's $3,500 per month as my expense. And so for the small group, I think it's a little bit easier to answer that. For the large group, because you must offer it, one of the pieces that I also want to bring up is that the employer must pay at least 60% of the employee-only premium. Okay, so if you're a large employer, we're probably seeing numbers for an HMO plan probably around $300 to $400. And if you look at what the employer, so let's use $400 as a number. 60% of $400, you look at an employer paying about $240 of it, and then the employee picking up about $160. The key is we just need to make sure that $160 is not more than 9.5% of what they make. Okay. There's a second part as to how to kind of keep the cost down. Is that right?
Yes. Yes. Well, it looks like they're hiring people, and so it's going to be hard, I think, for them to project what they're going to end up paying.
Well, if you're under 50, easy project because you can use the fixed dollar amount. Over 50, tougher. What we're preparing our over 50 clients for, we're telling everyone expect 20% in the upcoming year. Expect 20% in the upcoming year.
Okay, good. Thank you so much. Jane has a question. Will the penalty for not carrying insurance be collected through the workplace or tax return?
Let's talk about two types of penalties. The first one is on the individual side. So if the individual doesn't have insurance and cannot provide proof of insurance, the penalty is going to come through their tax return. Hold on one second. I'm going to get clarification on the employer side. Hold on one second. Okay, thanks for holding there. So while there are still some room for how they're going to do it, our understanding at this point in time is that once an employee triggers a penalty, then they will receive a bill from the IRS for the penalty. That being said, obviously we can't provide any tax advice as to how to do or deal with it, but that's our understanding as of right now.
Okay, great. And Crystal had a question. What if an employee decided not to receive health coverage? Will the employer be responsible for the penalties?
That is a great question, and probably one of the top questions that we receive. So let's go back to the example, $400. Employer pays 60% of it. Employee pays 40% of it, $160. The employee says, I don't want to pay $160. I haven't had insurance for a long time. As long as the employer has met those safe harbor rules, meaning it was affordable and it was a decent plan, then the employer is off the hook. It doesn't matter what that employee does thereafter. So the employee, of course, will have to pay the penalty, but it's pretty small.
Okay, great. Thank you. And Claire's wondering, when you're talking about the income, employee income, is that a figure used gross, or is that net?
It is gross. So it's gross income when you're calculating the safe harbor rule for the employers to protect them from having to pay the penalty. It's 9.5% of their gross employee-only wage. But when they go to the exchange, they take into account the full family wage, full family earnings.
Okay, good. And then Kimberly had a question. I was told by my broker that if you have part-time employees and they add up to equal a full-time employee, I was told by my broker that if you have a part-time employee, they would add up to equal a full-time employee. Are they wrong? I think when they're calculating the 30 hours,
Yeah.
Maybe that's it, Kimberly. If not, certainly send another question. Did that make sense to you, Lawrence, what I read?
It does. It's a great question to have. So I believe the broker, I'm hoping they meant it this way, and I'm sure they did. The first thing you have to determine where full-time equivalents, where we need to calculate that is to determine if the group is over 50. So once you're over 50, then there are no penalties for folks unless they're full-time. So let me clarify. Let's say I have 40 full-time employees and 40 part-time employees. Okay. So the way that would work is, for the sake of determining whether or not I'm subject to the penalty, I would add the full-time and the full-time equivalent. That would push me over the limit, and I would be subject to the penalty. Now, in the penalty phase, I only have to pay. I'm only penalized on the full-time employees. So in that example, we have 40 full-time, 40 part-time. I definitely have crossed over the 50 mark in terms of full-time equivalents. I'm subject to the penalty. Now my penalty will only be based off of the full-time employees. I waived the first 30, so in that example, I'll only be penalized for 10 employees out of the 40, and I multiply that by 2, or $20,000.
Okay, great. And then Claire had a question on the Cadillac tax. If benefits are added to the W-2, will they still be able to be deducted? And is it the total amount of what the premium portion is only?
So right now, the amount that employee pays and an employer pays through for medical insurance is tax deductible. We think that might be something that they go after in the future. So if there's a way to vote for that, against that, please keep that in mind, because we think it's huge to have this as a pre-tax benefit. For the Cadillac tax, in 2018, what I will say is that I think a lot of things are going to change as it relates to that law by the time it comes around, whether it still even exists, and whether those dollar amounts are still the dollar amounts there. But I think I'm missing part of the question there. Can you let me know which part of the question I'm missing?
Do you think the Cadillac tax, if benefits are added to the W-2, will they still be able to be deducted? And then is that total amount, oh, go ahead, I'm sorry.
Yeah, it'll still be deducted, but then there'll be an excise tax, a 40% excise tax that they're going to charge those employers, not the employees, as I understand it.
Okay, good. Thank you very much. Oh, go ahead. Okay.
Please.
And then Jen said, I'm wondering, are there companies that are going to be grandfathered out of this Obamacare? And if there are, can you tell us which ones will be?
Yeah, so grandfathering, right now I would say probably somewhere around 1 to 3% of all groups. We have about 300 companies that we represent. We only have 2 grandfather plans. The grandfather plans, they can't get out of all things, but they are able to get out of many things. And grandfathering, just for the folks who aren't familiar with it, is when President Obama campaigned and he talked about healthcare reform, he said, you can keep the plan that you have today if you like it. And the key is that you have to keep it almost identical to what you have today. It cannot move very far off. If you do that, there are some benefits to grandfathering, such as you are allowed to favor the highly compensated, such as you don't have to have the limit requirements. You don't have to have the preventive care items. So there are many pieces. that actually cost money for the plan that you can avoid. So a lot of these healthcare reform items, the 5% I talked about in 2014, the 2.5% that we talked about in this year's renewal, a lot of that would essentially not be charged to those grandfather plans.
Okay, great, thank you. And Julia has a question. Their company appears to, have seasonal workers, and some don't average 30 hours every week. Do we base the calculation on total hours last year? Is it a rolling average? How do we figure that?
So this is where you definitely need to involve your broker. I'll give you some general guidance on here, and this is where I think it's fun. But here's in terms of the calculation. What's important is if you are over 50, and remember the calculation for seasonal, all stuff, all you try to do is figure out if you're subject to the penalty or not. So if you have a lot of seasonal employees, the way it works moving forward is that you're going to determine what we call a measurement period. The measurement period is where you measure how many hours that person works during that time. You then, moving forward, have a stability period, and you say for all those people that worked over 30 hours on average during that time, you will then offer them benefits in what we call the stability period. This is why this is why we said that if you want to minimize the penalties, it's critical that you start your planning on July 1st, because that's when you can start your measurement period and start, saying if someone's at 32 hours, getting them to work at 28 hours on average, and that way avoid the penalty. One other thing that we want to point out is that seasonal employees are only considered seasonal if they work less than 120 days in a year. We have folks that work 180 days in a year, and they think, oh, that's only half of the year. But 120 days is the magic number on that one.
Okay, great, thanks. And Claire has a question. Is the penalty a one-time for the year, or is it a per month, per employee type of thing?
It is one time per year per an employee that does not have coverage and goes on to the exchange.
Okay, great. And then Roger had a question about dependent coverage. If a dependent is working for another employer and choose to opt out, and then can they opt back in later?
The way we see it is we don't see any changes to the current rules, and the current rules are this. If there's a life event, you can always come onto the plan mid-year. Life event would be marriage, divorce, loss of a job, probably the most common one that we see spouses coming onto their spouse's plan. If in the absence of one of those life events, the other area where we believe the employee still has the ability to come on is open enrollment. So open enrollment and life events, we don't see anything changing in regards to those.
Okay, good. And this is kind of a good wrap-up, I think, for us, because we've only got a few minutes here. If the company has under 50 employees, what should we be thinking about right now, Lawrence?
Yeah. If you have under 50 employees, really what you have to worry about is making sure that you provide notice to your employees and that you adhere to that you comply with the rules. Right now, that means the summary of benefits and coverage is going out in a timely manner. I know that they are not enforcing it this year, but good habit to have, and having them sign off on it. If you're a company under 50, making sure, a lot of the pieces are being driven by the carrier, and it's just a matter of you delivering it to your employees. Okay, and at the end of the day, don't feel like you should be alone in this process. Your broker has the tools, and your broker is someone that should be helping you and holding your hand through the process on this.
Okay, good. And Angie has a question here. We're located in California. Does that mean that now I have to reduce the probation period to qualify for benefits to 60 days? We currently have a 90-day period in place.
Yeah, so as it stands right now, in the state of California, we understand that they're moving to a 60-day, and yes, and you'd have to move to 60-day. Again, we hope, and they're in the works of trying to make it first in the month following 60 days. We like that a lot better administratively But yes, if you're anything above the first of the month following 60 days or the 60 days, it's likely that you'll need to change, okay? Now you have some time, right? And we'll also have more guidance between now and the end of the year, but it's likely you'll need to change.
Okay, good. Thank you. And again, we talked a little bit about the under 50 employees. Can you, Lawrence, just summarize for us right before we close here, if a company has over 50 employees, you know, how would that company then minimize the penalties? What are some pieces of advice you can share with us?
Certainly. First thing is that you can run a payroll report, and anyone that's, let's say, that works 32 hours, right, that works 32 hours, you can run payroll reports and just maintain their hours below 30. That's an easy way of doing it, and you can't do it last minute, because if you do it last minute, again, they'll take that look-back period and say, no, that employee was a full-time employee, and moving forward, you have to offer it for them. So you must do the planning, and the planning really means adjusting the hours. And there are a few other proprietary options that we can share as well, and we can help them offline with that if they have more questions on it. But mostly what people are doing is to manage the hours.
Okay, great. Thank you. Well, that is all the time we have today for questions. Again, Lawrence Hartley with Oak Ridge Advisors, thank you so much. We really, really appreciate your conversation. And Linda Duffy and with Ethos Human Capital, and Marla Merab Robinson with Merab Robinson and Jackson, thank you so much for bringing Lawrence to us to kind of learn a little bit more about healthcare reform. Please look for announcements for our next webinar, Hiring Employees, What Employers Need to Know. Linda and Marla will again be teaming up to tackle that topic, and we selected the date April 24th, which is Wednesday next month at 11 o'clock. We certainly appreciate your time today, and we look forward to providing with the most useful information in the future. Linda, Marla, Lawrence, do you have any parting words here for our attendees today?
Nothing but
no.
thanks.
Yeah,
Thank
thank you,
Lawrence. That was excellent. Great.
Great job on that.
All right.
Everyone,
Well, go ahead.
I was just going to say, everyone look for an email tomorrow. There's a couple of bonus handouts that Lawrence is providing, so we'll be sending that out. And also, if you would just take 5 minutes to just complete a short survey for us and give us some feedback about today's presentation and any topics that you have in mind for future presentations, we'd love to get that feedback.
Great. Thank you again, everybody, and we will see you next month. Bye-bye.